Welcome back. This is another episode, Blood and Guts Surgical Expert Breakdown. My name is Dr. Stephen Cohen. We are here today with a very special, interesting, dynamic physician, Dr. Pearlstone, who is and trained as a surgical oncologist, but has a very unique perspective to not only the medical legal world, but started a very interesting and has a company that you are going to really want to see. So thank you and welcome, Dr. Pearlstone.
Thanks, Stephen. It's really a pleasure to be here.
So let's start from the beginning. So you are a surgical oncologist, but you're not practicing. Tell me where you trained and what transitioned you to what you're currently doing now.
Sure. I'll try to keep it brief. From New England, grew up in Connecticut, went to med school in New York at NYU. As I like to say, I drank the NYU surgery Kool-Aid, did surgery at NYU. I spent a couple of years at Sloan Kettering in the lab doing research, and then did my clinical fellowship at MD Anderson, and went and practiced surgical oncology for a lot of years. And then in 2006, I moved back to my hometown, back to Connecticut, because I wanted to. And there was a position at Yale. I was recruited to Yale. So that was great. And there was a lot going on, as there still is in healthcare. And at the end of the day, what happened is I was driving down the road and I heard an ad on the radio that Yale was about to start a specific MBA program focused on healthcare. And, it was a executive program, et cetera. And honestly, I thought that sounded interesting. And it was literally just up the street. So I went and I met someone who's now a close friend, Dr. Howie Foreman, and did not take him long to convince me to go to the program. And I went and I absolutely loved it. I had a tremendous experience. And then I did what a lot of doctors do when you get an MBA. I started doing sort of administration stuff and less surgery, more and more administration, and worked my way up the ladder. And that was all well and good, but I wasn't terribly satisfied. A lot of frustration. I always say, if you think being a surgeon's tough, try being the boss of the surgeons. It's not a terribly rewarding job. So anyway, again, through a lot of wonderful networking, a term that I don't love, but I have to say it's such a great reality. But through connections, I sort of stumbled into the startup world, and I became the director of an incubator in New Haven, and my job was to sit in a beautiful office overlooking the green, and basically vetting companies of potential venture investment. And one day in walked my now partner, and he pitched the now company that I'm now CEO of. And it was a really cool experience because they were frustrated. When they showed me what they had developed, I was completely blown away. The technology was extraordinary. I kept accusing them that it was fake. This can't be real. So quickly, what is it? What our technology does, it takes a CT scan, which is a bunch of slices, and converts it into a three-dimensional image that you then view in extended reality. So augmented reality, virtual reality, any of those platforms. We work on all of the platforms. So you now see your CT scan sort of as a floating object in front of you, and you can do many things with that as an object. Take it apart, put it together, different parts, operate on it in the virtual world. You can take that image and put it on top of the actual patient and lock it in the right position. And now you've developed a virtual X-ray vision, right? Because you're looking at the patient there, but you can see the internal structures from the CT scan. So they had developed this technology. They were frustrated because nobody seemed to be interested. We got into a conversation, and essentially, based on my lifetime understanding of medicine, I knew exactly why they were frustrated. They were sort of trying to show this to the wrong people. And I said, you should be showing this to people like me, surgeons. We got into a great conversation. And he said, would you be interested in working with us? And I said, would you let me work with you? This is amazing. And 2 weeks later, I was CEO. And so that was
when was that?
That was 2018. So this It'll be so it's just 7 years now. Geez, wow.
So
um,
tell me how it, so again, there, no doubt. I mean, and I always say this all the time, CT scan is a two-dimensional picture of a three-dimensional object. If we can, augment that, and one of the vascular surgeons I work with is really big in 3D printing for the same type of thing. So explain to me the difference between a 3D printed image that we can take a complex, pancreatic mass that might be encompassing the vessels that we're thinking about a surgical resection. How is it different or utilized virtual reality, what you're talking about, versus 3D?
That's a really great differentiation. We are cousins very much so to the world of 3D printing. The entire process is the same up to almost the end point. The way you take the CT scan, what you do to it to create these images is all the same thing we've been doing for years to do 3D printing. But instead of taking that file, the exact same file that you literally put into the printer, if you put that file into our system on a head-mounted display, any one of these devices, AR, VR, headset device. What you would have seen as a printed model, you now see as an image. But this is where it gets interesting. 3D printing is tremendous and has great applications, but it's got a lot of limitations. So to take your example of a pancreatic mass, that would be difficult to depict in a printed model because let's say this is a surgical oncologist, the things you would want to see, you want to be able to walk all around them and
Yeah,
up and above and below and really see this one particular spot from many different angles. And you can't really do that with a printed model. And that's really sort of the beauty, one of the great things about this type of viewing. So viewing what we call extended reality visualization, that's I think a term we're going to hear a lot of, ERV, extended reality visualization, is a great way to view, exactly as you said, images that are 3D. Something that is 3D, let's view it in 3D. Now that we have that capability, and to your point, interestingly, it's even more that the CT is a 3D image. The image is actually obtained now because we do helical CT. The image acquisition is actually as a 3D object. And so for the last 20 years, we've been taking that 3D object and slicing it back up into 2D slices because we
right,
didn't have a way to view 3D things. Well, now we
right,
do. And so I think we're really just on the forefront, I believe, of a very new way of viewing the images. Nothing's going away. This is
right.
building on top of things. We're still doing CT scans, and it's still going to, everything's going to be the same as it is. But we're going to now have a new way of doing things. 3D printing has tremendous things that are always going to be valuable. But adding this on top of it brings a lot of value. And it's a lot less resource intensive than 3D printing. 3D printing is very resource intensive, which is a healthcare economics code word for
Right.
expensive.
Right. No,
Um,
absolutely. In our VA medical center, we have a multi-million-dollar machine, but that's not the norm, right? Not every hospital in the country's got a multi-million-dollar machine.
no,
We do,
and
but
and how often are you printing? What are you printing? What's the real value of it?
right,
And we can produce these images in 1,000th of the time, not
right,
even instantaneously. Printing takes hours, the cost, et cetera, et cetera.
right. The other question I have is, and you know better than I, but how is AI playing into your company or any of this? What does that mean for your
Yeah,
company?
AI is a very, very, very important part of this industry, if you will. It's what I would call upstream from us. The way that you take that CT scan, and now I want to see the pancreas and the tumor and the portal vein and very specific things. I don't want to see a whole bunch of other things. How does that happen? That is a process. It's called segmentation. That is a process that was born for AI. It's
Right.
absolutely suitable to a machine learning algorithm, and that is happening. So that process now has become push button, if you will, for many, many, many structures. I can take a CT scan, put it in, and literally click on one thing and get the shoulder, the knee, the ankle, all of the bones identified and beautifully, taken out of the CT. So there will be a time, I can't help think, in the future when you'll be able to basically dial in anything you want out of a CT scan, and it will pull that out very beautifully. The way CT scans are done, the fact is the data set, the data, the information that's captured in the CT scan, we are, I mean, not even scratching the surface of the data that's already there. We can spend a very long time just working on what we have before we have to make better CT scanners.
Yeah, that's
There's a
interesting.
lot of data in there now that we just cannot visualize, and
Right.
just so therefore it's hard for us to use.
Right. That's interesting. Tell me a little bit about how this potential technology can be used in the medical legal world.
That's a great question. I guess I sort of have to make a little disclaimer as a clinical surgical oncologist. It's medical legal is a difficult, I don't want to say it's a difficult application, but it's a very necessary application. And the goal as a surgeon in the world of medical legal is to ensure that the information that I work with is being presented properly and correctly. And I don't go beyond that. Everything else is a lawyer's job and a jury's job and everything
Right.
else. And I don't make decisions about what's right and wrong. It's not my job. But our technology can make the information that you want to talk about and use to discuss this case. I believe we can make that much more understandable to not only the attorney, but the lay public, the jury, and the
Right.
judge,
And
and
that's what the
everybody else.
reason I ask, because a lot of times when I'm in a courtroom and I'm asked to explain adhesions, which is scar tissue, to juries, they look at me like I have three heads. Well, to
Sure,
me and you, I know what that is, and you know what that
sure.
is. The judge doesn't know, the
Yeah.
attorneys don't know. So that's why I thought, maybe
Many,
this kind of
many,
technology.
many of the complexities of a surgical case or a surgical complication are things that are related to the 3D nature of the situation. You push the
Right.
needle too far, you cut a little
Right.
too far, too deep. Those are three-dimensional concepts that are best
Where is
understood
the
in the
ureter in relation to the
exactly where.
colon? How
Perfect
did this
example.
injured?
Perfect
Right.
example. Where was the ureter? Where should you have been? Et
Right.
cetera, et cetera. So I really think it's an interesting progression. It's a very, in my view, a very, very natural progression in the courtroom, if you will, for the use of this that go back to Perry Mason a big pad of paper and draw all that. And then I guess in the 60s or whatever, we got up to overhead projectors. That was kind
Right.
of the real standard, right? In the courtroom, you'd see overhead
Right.
projectors, right?
When I
And
trained
then
as
we
a
got to,
resident, I used overhead projectors. I got it.
sure.
Okay.
And now basically video, right? They'll wheel in a big cart. I mean, that's sort of the memory of OJ
Yeah.
child. I was the big carts with TV sets being wheeled in with all those big old fashioned VCRs, the top loading cassettes
Right.
and all that, right? So, it's it's a natural progression to think that the next thing would be the jury being able to view this in 3D. And one vision of that is a jury, a judge, all wearing headsets. That's entirely a possibility for sure. But there are now and will continue to be ways that are much less cumbersome, that we end up with that. But there's a long way to go with the technology. But the point being that the underlying principle of what you're trying to do here, take an image that contains tremendous amounts of information, very important information, but it's not easy to understand that image. And I always say this, it took me 10 years plus to get good at reading a CT, and I'm not
All of
in,
us.
there's people way better than me.
Right.
Um, so how do you expect someone to understand the vitally important piece of information is right here? You can take my word for it, okay? But if I can show you in a much better way. So yeah, I think I think it will be a welcome concept. Anything that makes things more clear, how can that not be a good thing?
No, I agree. And the other thing I was thinking when you were talking is not just medical legal cases, but in personal injury cases and car accidents and where was the car and what was what they do, which I don't know what they do, but I've seen it on TV. What were the roads like? How long was the
Sure.
light yellow before somebody went across? And you said,
Well,
you know
you've
what I'm
seen that
saying?
a lot of simulations where they
Right.
will take a bunch of data, and based on that data, the distance from the car to this and that, whatever, they can recreate a quite realistic scenario in 3D. Yeah. I think we're on the edge of a very exciting, cool time. It's pretty neat stuff, I have to say. As the old man in the industry, I'm very much one of the old men in this industry. I find it very, 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 very exciting. It's really
Well,
unlike
I
normal.
resemble that remark. Thank you so much for that. I appreciate that. That was
I only
helpful.
refer to myself.
So no, but that's, I think this is great technology. So let me end on, if someone wants to look at this company or find you, what is the best way that they can find you?
Thank you. Always good for the plug. As always, anything, our website, www.dicomdirector.com. That's our website. If you really want to cut to the chase and see some fun stuff, go to YouTube. Just search DICOM Director on YouTube. You'll find our YouTube page. And there are some very nice videos edited, and they look really nice. That shows our technology in a very cool way. If that appeals to you, then you can take a deeper dive. Anyone, please feel free to reach out to me. I'm always happy to talk about it. That's the one thing about being a founder in a startup. Your
And for those listening or watching, and sorry to interrupt, for those listening and watching, I will put the links to this either on LinkedIn or on the show notes. If you're looking at this on Spotify or YouTube, I'll put the links there to make it easier for people. That's not a problem. But let me ask, if my hospital is interested in this, is this something that, has this been rolled out that can be used currently?
Absolutely. Yeah. Oh, sure. Yeah. We're on the market. We have many active users. We have a very global footprint as a company. Our DNA, if you will, my partners, we have a very global background. So we're involved in a lot of places, certainly the United States. But some very exciting things that we're doing. We're just got approval from legal at Sloan Kettering to be starting a very interesting trial of breast reconstruction. We are starting a trial this very soon, within the next few weeks, with the National Health Service in the UK at 3 different sites. There is big interest in using this. Again, it's just starting on the level of patient education and pre-surgical planning. And then, of course, there's a lot of potential for this in the future. We are in the process of our FDA approval for this. Everything's being done under protocol, as it should be. Yeah, we are being very actively used in a number of places. Brazil is a very big market for us. And a number of academic centers in the US as well.
Well, the reason I'm asking is, most of the surgical training in this country and most of the very robust data, because we have access to it, is in the VA system. And
the VA has a really robust history of jumping in on extended reality very early on. Very hats off to the VA for that. I could not agree more. There's a great structure, and I am very interested in anybody in the VA system that has an interest in doing a project. We would love to support a research-based project. We will make it financially very simple, let's put it that way, very, very easy for something that really has some meaningful work. We would absolutely love to help out at the VA. I think it's just got great opportunity. I love patient education. Informed consent is a wonderful place to work. In the VA system, I just feel like it's even all the more important because it's very easy for people to go with the flow. And it's important that people take a moment and do understand their conditions. So yeah, I would love the opportunity.
Great. Thank you so much, Dr. Pearlstone. Appreciate everything.
My pleasure, Stephen. Thank you very much.